Many women in perimenopause and beyond complain about dental problems, including sensitive teeth. Now, you may have sensitive teeth because of lack of saliva and a change in pH in your mouth, and that can happen for many reasons. I'm going to talk about a few things that cause sensitive teeth and what you can do about them. And first, I'm going to brush my teeth, but I'm also going to put some makeup on and head into my office. On the one hand, having sensitive teeth when you are in midlife can be a symptom of perimenopause, but it's not necessarily a direct symptom. And what I mean is, teeth don't just become sensitive because of hormones. There's a lot of factors that can play into having sensitive teeth in perimenopause. So today we're actually going to focus on just the oral environment behind sensitive teeth. Sensitive teeth can happen for so many reasons, including gum recession or loss of the gum structure around your tooth where the root, which is really sensitive, the root of your tooth is showing. You can also have cracked teeth, loose fillings, gum disease. There's so many reasons for sensitive teeth. Through this video, I'll be talking about 3 things that might contribute to sensitive teeth, and I'll give you some tips throughout. Everything here is for information, education, and conversation only. All my content is not medical advice, mental health advice, or dental health advice. Find a licensed care practitioner for your health if you struggle with any type of healthcare issue, oral health issue, or mental health issue. As we age, our mouths get drier. This is due to hormonal changes, drop in estrogen and other hormones. You may have dry mouth. So, the first thing you need to think about is how hydrated are you? Hydrate, hydrate, hydrate. There are things that you might be drinking that actually dehydrate you, and one of them is coffee. So if you can, have some water before you have your coffee in the morning. I talk a lot about this in my 5-day mini course about boosting your energy in midlife. Hydration is key. When you have dry mouth and you start to drink coffee or tea, I'm looking at my desk because I have tea on my desk, or wine, or even that lemon juice. I talk a lot about lemon water and how that can erode your tooth enamel, even though a lot of holistic health advice says drink lemon water or apple cider vinegar. Those things, when you have lower saliva, can just change the pH of your mouth so slightly that you might lose tooth enamel. And that's one cause of tooth sensitivity. Another cause of tooth sensitivity, which may or may not be related to anxiety, is clenching or grinding. We call that bruxism in the dental field, and that can be anything from micro clenches while you're driving the car. That's where your stress gets held in the head and neck. Or perhaps when you fall asleep, you're actually grinding your teeth, and your savvy dental hygienist or dentist might say, I see a little wear on your teeth. What happens is your tooth gets all this pressure, and there's little enamel rods along the bottom, and what they can do is pop off. That's a really simplistic way of describing it, but that leaves this vulnerable dentin in and around your gum line, and sometimes little notches. We used to call them abfractions. That can be sensitive. You put a toothbrush on there, you have some cold water, or you have some sugar, and whoa, it can be really, really sensitive. That's because when you're clenching, these little microscopic rods flex, and they kind of, I guess you can think of them as kind of breaking. Another reason that we can have sensitivity is abrasive toothpaste. A lot of commercial toothpastes are a little more abrasive, especially if you're looking for the whitening toothpaste. Now, I know we see lots of pictures in magazines. I love the white tooth look. I mean, I was in dental for 23 years. We see lots of pictures of white teeth, and that's part of that youthful beauty. Many of us have whitened our teeth, but we might go to a toothpaste to start to scrub off stains, because that's what it's doing. It depends on the type of toothpaste, but some toothpastes will have like a whitener that kind of bonds to the tooth, and it'll have hydrated silica or some type of grit that rubs the tooth enamel. So if you're taking that toothbrush with that particular type of toothpaste while you have a low pH or less saliva, you may do some damage to that tooth structure and cause some sensitivity. Think sandpaper on a thin, thin cone of paint. If you really rub it, you're going to lose the paint. Another thing that seems to be a little more common is acid reflux, also known as GERD, in menopause. Actually, that can hit in a lot of different times of your life, and sometimes it can be silent. You may not know you have reflux. Again, your dentist or dental hygienist might look at your mouth and say, oh, there's some wear on the teeth. Are you brushing hard? Do you have acid reflux? And you might say, no, I don't. I don't have heartburn. I don't feel it. I don't taste anything in my mouth. No. So you could have a silent reflux. And this can actually be linked to some sleep disordered breathing issues. This type of condition can cause erosion and it can also cause sensitive teeth. But so can those acid drinks like the lemon water, like the apple cider vinegar, soda pop. I hate to tell you, wine. I know wine can be a woman's best friend and worst enemy in perimenopause and menopause, but they can erode your tooth enamel. Now, another sly little thing that rears its ugly head in the menopause transition is eating disorders. If you are prone to an eating disorder, if you feel that you might be succumbing again to an eating disorder as far as bulimia, this can erode your tooth enamel. The acid from purging bathes the teeth and erodes the tooth enamel. Anorexia affects oral health due to lack of nutrients. Anorexia and bulimia may be paired or separate, and they both can really affect oral health and, of course, mental health. And we would always, at a dental office or even in this video, have you seek help from a licensed professional to discuss any of these thoughts coming back into your life, these patterns, etc. And feel safe, I should say, to discuss this with your dental hygienist or dentist. They're trained to help you mitigate the effects of acid on the tooth enamel. So what can you do to help your sensitive teeth without buying, say, sensitivity toothpaste, which you can? I was thinking about making this video a little more like lifestyle focused rather than product focused. But if you'd like to hear about certain products that you can use to help your sensitive teeth, put a tooth emoji or pop sensitive in the comments below, and I will either make another video or answer you below, because there's a lot of philosophies of what could be put on your tooth as far as your sensitive teeth. Everything from fluoride to hydroxyapatite to natural solutions. Let's talk about a few things that you can do to help sensitivity just by changing a few things in your life or lifestyle. Say you clench and grind. Maybe you kind of wonder if you clench and grind. If you're waking up with temple headaches, a little soreness here, if you wake up with sensitive teeth, or maybe you actually notice that your head and neck feels a little sore and stiff sometimes. Do you notice that you carry tension in your jaw? And if you do sleep with a partner, sometimes they might say to you, "Oh my gosh, I can hear you in the middle of the night." There are actually people who have some snoring disorders that still clench and grind. It's kind of wild. So start to pay attention to how your upper body feels when you wake up. And then, of course, I'm going to tell you to visit your dental professional and ask them for any evidence of grinding, because it's not always wear on the teeth or little notches on the side of the tooth. It can be those feelings of head tension, neck tension, headaches, waking with headaches, which can also be an airway issue, which really just shows that we have to have these things assessed. If it is a clenching and grinding issue, your dentist might be able to give Brux guards, a little grinding appliance that helps the jaw joint. Now, there's all kinds of other solutions when it comes to clenching and grinding. Some professionals will address this as an airway issue. I just want to bring to light that there are options as far as a dental appliance. I would never suggest that you go buy one at the grocery store or the drugstore. Having them professionally fitted is in your best interest. But there's other things you can do. Check the alignment of your head and neck. Can you see a chiropractor, an osteopath? Can you have some massage? Can you even pay attention to the posture, the forward posture that you have at your desk in the day? I know I am guilty for all of that. Guilty, guilty, guilty for all of that. That can actually throw the head and neck off. And sometimes it's something you can't control. It is the way the jaw formed, the way the TM joint sits in the skull, and you can't do much about it. Now, I'm going to get to the wine drinking in a second, but first I want to talk about toothbrushes. Stop buying hard toothbrushes. Don't buy medium toothbrushes. Buy a soft toothbrush. Your dental hygienist can show you, I guess I could do that too here, how to brush your teeth, but it's sort of different. There's little nuances for everybody. Don't scrub your teeth, especially after the wine, because that actually weakens your tooth enamel. You can wear it off with those hard toothbrushes. And then you add the whitening toothpaste with those hard toothbrushes, and then whoa, whoa, it's like, again, the sandpaper, but like the heavy grit on paint. An electric toothbrush can be your best friend with the right technique. One big thing in perimenopause is that we can be on medication. Many people are on medication for anxiety and for diabetes, high blood pressure. Lots of medications can cause that dry mouth, so water may not do the thing for you. There are xylitol lozenges that some people find very, very helpful. And in holistic circles, sometimes these artificial sweeteners get a bad rap, but for some, something like xylitol can stimulate saliva and really give some comfort in the mouth. And it also can neutralize a little bit of plaque bacteria because of the xylitol itself, or just because it's getting saliva going. So ask your doctor if your medication is going to cause dry mouth, and start incorporating a little more water, some chamomile tea, some of the ginger tea that I have here without the lemon. I have a video about that because that can be very helpful in your mouth. Your mouth is part of digestion. Okay, let's talk about the wine. If you drink wine or any other acidic drinks, time your toothbrushing. We're going to talk about this. On this channel, I want you to enjoy your life. So if you enjoy a glass of red or white wine and it's okay for all the other things that you're doing as far as medication, well, you might be dropping the pH of your mouth. And with red wine, I think what we want to do is go into the bathroom and scrub, 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 because we can get a little more stained, right? Have you ever been out for nachos with your friend and she's having red wine and you can see the red on the teeth? Many of us want to scrub that off. Well, don't. It's best if you can wait for 30 minutes for your saliva to flow back into your mouth. That helps remineralize your teeth, puts mineral back into the tooth that pH drop in the mouth might have pulled out. Again, I'm talking in simplistic terms here, but when you wait 30 minutes to brush your teeth with that toothbrush and even toothpaste, you're allowing that saliva to come back into the mouth and change the pH in a positive way. And that way you won't be scrubbing off any delicate tooth enamel and increasing your sensitivity and increasing the dark look of the teeth, because that's the dentin underneath, and the tooth enamel, which isn't always naturally white, covers that. It's covering that, and that's helpful for a whiter appearance. Just remember that everybody's teeth are varying shades of like white-ish, yellowish, brownish, even like a little bit of gray. But I know in this society and all the youthful beauty, we don't like that. So have your wine, but rinse with water and wait 30 minutes to brush your teeth. I hope this was helpful. I feel like I could do a lot of videos on how our oral health changes in menopause, but how it is so connected to the rest of the body. It really is. If you have any swollen gums, bleeding gums, that is an entranceway for bacteria into the mouth. And that can cause some inflammation in the body. The oral health is very connected to whole body health. So if you're looking for an area to target in your health in perimenopause and menopause, your oral health is huge. And for some, it might be a really easy habit builder to start brushing a little more gently, brushing a little more, and yes, maybe adding in that floss. So I hope this helps you if you have sensitive teeth, and don't put sensitive teeth down to being just a perimenopause symptom. It is an indirect symptom of other things that are happening in the body, and your dental professional can certainly help you with that. And now that this video is over, I would love you to go and grab a glass of water and start sipping to get your mouth hydrated again. And we'll talk again soon.